painful.
Rated from 1 to 10 now?
I treated yesterday twice, and so today it's actually the best it's been in the last few weeks. So I would say today is about 3.
Okay. And can you walk when you walk around as well, or only when you rest and you feel it as well?
You know, actually after I've been sitting.
So remember now when you remote, you get
Yeah,
up, you
just
motion, you feel it right now.
Yes.
Okay.
And it's right through here.
Okay. It's not necessary that I'll be kneeling. Using the opportunity to clean the voice.
Thanks.
Okay. As I said, I'm looking at the palms of the hand.
What about coldness or hotness?
No,
You
I'm
know,
just looking at the texture. I wanted to see
Vitality.
The vitality on my hand. Okay. Looks like this hand is less vital. It's more. This is more showing up in this hand.
Less blood flow.
And then the next. As you can see, his hands are resting in my hands. I'm using my thumbs now, out, around, larger than my claw, and then inside and
left side is
okay,
very
that's
sensitive.
I remember what the results were because I'll come back to it and I want to see it even out. Okay, so I'm beginning. I can start with the lumbar area, I can start with the cervical area, whatever is more comfortable for me. So cervical area, feeling sensitivity, no?
Actually, pretty gentle compared to Kiko or something.
Good, no? No?
That one is probably.
Okay. The deep one. So what I want to use is deep, which takes up the most area. Even though it's not on the same side. When you feel, you see how I'm pressing down with my nail? What I'm doing, if this is the needle, my nail is guiding me, and I'm feeling also with the skin. Then when I found the sensitive area, I'm pressing down more with my nail. Also, when I insert the needle, he'll less feel this is psychological for operation. It's easier for him to feel the nail than the needle. So, and then I'll be inserting just under my nail. I'll be inserting under my nail. As well. Do you feel sensitive? Yes. Then I go back to the bell point area. Right away. This one? Now you get up. See how? But it's still a 3.
Maybe 2.
Okay. But now, because I said I'll just go up to see that nothing that popped up. Because sometimes once you insert the first needle, things can pop up. You can see I'm not applying any manipulation to the needle. That was your question.
How did you choose? So it's a 2 centimeter zone, and how did you choose?
I just started from the top and I started moving down around the sensitive area. Now, see how we go.
Just a little bit left.
Okay.
Let's decrease.
See, and I haven't even touched points on the same side that I've got to do with the foot.
this one's more sensitive too. We bring more sensitivity into the
No, what happened
awakeness to
the first needle sometimes starts rousing up the water. So things are starting to come up. The B point.
So what angle are we putting here?
It's just because it's comfortable for me. I could do the same. I could go like this angle, whatever. For me, it's more comfortable for the way I'm sitting.
But for this, we said we want to use the direction.
But only if you had a
Radiate
pain.
Okay.
This one's still
You guys spoke before.
We planned.
yeah, very good.
Now see how we put it? Pretty good. The magics of YNSA. Now that
Not bad.
okay, you can see that.
And it's even, yeah, it's even.
Now you can see even that the colors. Now we'll wait for about a few minutes and you'll see that the colors will change. But basically that's the treatment. Very simple. And that's magic sometimes. And once you put more trust into the system and believe in the system, you'll see your results will be even better. Okay?
If you want to get specific to the heel, is there a...
There is a point. We haven't learned it, but there is a specific point for the heel. And also eye that we will learn also has a specific area.
Okay.
But as you can see, none of the points are in a specific area, except points that are added later on. One of them is on the zygomatic bone. Okay?
And you said yesterday, last night, you suggested that maybe even the C point could, on the opposite side, could reflect.
Oh, that's it's a way of thinking. Yamamoto, when you see him treat, he does Dr. Kang in treatment. He doesn't see any improvement, then he'll do reflection, like apply acupuncture for a heel on the hand. I also found myself doing it. I had a patient suffer from stroke. Every time she had one side was paralyzed. And every time I asked her to move her hand, she was moving her leg a bit. And just before she was released for the, I said, why don't I just try and apply a needle into the leg, the foot. When I moved the foot, she started moving her hand. So it was just playing around. Well, just straight after I came back from Yamamoto, when I saw his way of thinking of changing, otherwise I don't think I would have thought about it myself.
How did, like, this is the
E point.
how did you know where on the E point?
Just more sensitive.
I'm just looking for sensitivity on all the points.
So you just bring your finger along the
Exactly.
arch here and wherever. And you could feel the sensitivity and you could feel
I
the
can feel
sensitivity?
the opposite.
But you found it.
I found I was looking for a granule in skin.
So why does it matter what area is T1 and to T12? Doesn't really, it's more about word sensitivity.
It matters mainly in when you have to do the fine tunings with the patient, when it's already coming down to doing the fine tunings, and because there are patients that you don't see any response. Sometimes then you have to know exactly the areas where you want a pal point or needle to get a better result. And then it comes in. So you understand what I'm trying to say?
Yes, but it does want the area to be sensitive regardless to the fine tuning if I'm searching it.
No, but I wanted to, because on, let's say, A zone, I could have a few areas that are sensitive. I wanted to find the area which is more
Related to the flow.
related to the problem. Now, because you said it's chronic pain, right? It's been months. Now, when we get to brain points, the upper area of A is already starting to
Switch over.
overlap.
Overlapping.
When it starts overlapping the brain points, that's why I'm at the upper area of A where I know it's going to overlap with the brain. So and also I said the upper area of A has an effect on the brain. on the head. So that's why I chose that area.
And I know why you put the first one on the right side, because that's where
It's the side of the
pain
sensitivity.
was, but then how come the other ones you put on the
Because
left?
I went back, I went
Where you find the sensitivity.
well, I'm
with
always
the
looking
arm.
for
Okay,
sensitivity.
so, I wasn't noticing you tried the right hand and the left hand.
Yeah, all the time. But in the beginning, none of them were sensitive.
Right,
Only
they
after I
popped up
applied
after
the
you
D, they
had-
started coming up. So, what I split up into pairs. We have time. But